In terms of symptoms that patients complain of when they come to me with rotator cuff problems, usually it's pain, and most commonly it's pain at night. They have trouble sleeping, pain when they raise their arm over their head. If the problem has been going on for a longer time, and particularly in women, sometimes they can be very stiff. I like to have patients think of the rotator cuff as a room. It's a group of 4 muscles. I tell them that there is a ceiling, a front and a back wall, and a floor. And when you look at these injuries, the back wall and the floor hardly ever get injured unless somebody falls or has a major trauma. Most of the problems in the rotator cuff happen in the ceiling and at the junction of the ceiling and the front wall. So a lot of these problems really are a normal result of aging and arthritis and degeneration more often than their acute injuries. So when a patient raises their arm over their head many times, especially if there are any bone spurs or degenerative changes in this area, the rotator cuff muscle and tendon will pinch against that part of the shoulder blade. And over time, the degenerative changes in that part of the shoulder can start to dig little holes into the rotator cuff. And as that gets more severe and more prolonged in terms of that activity, they can start to get what we refer to as a rotator cuff tear. In terms of tests to figure out when a patient has a rotator cuff problem, like everything else, we start out with a history and a physical. And a lot of times, just from what they tell me, I'm able to make a pretty good guess that the rotator cuff is the primary problem. We always take x-rays because there are certain abnormalities of the bone, certain arthritic or degenerative changes, or certain shapes of the bone that can predispose people to rotator cuff problems. So x-rays can go a long way in telling or confirming from the history what might be wrong. In situations where the problem can be a little bit harder to figure out, we can go on with more complex testing. An MRI, which is a test that uses a magnet to take a picture rather than an X-ray, is very sensitive for rotator cuff problems. There was a patient that I saw probably 15 years ago, and when I looked inside his shoulder, there was very little rotator cuff left. He had a very large tear. I said, your tear was extremely large. We did a good job repairing it. I said, but realistically, what you do is probably too hard, and you may have to think about another job. And initially he was kind of discouraged, but he was very determined that he was going to get better. He went off and he did his physical therapy. And when I saw him 3-4 months down the line, he was doing pretty well, but he still didn't really have the strength to lift something heavy, and I didn't think that he was probably ever going to return to normal work. So he went off, and I didn't see him for a fairly long time after that. We had sent him back to light duty, and I didn't quite know what happened. And he looked at me and he said, "Hey doc, it's me. Remember you told me I was never going to get back to doing this type of thing? And look at me, I can do everything now." I guess that was the day that I really thought, like, this is great. It works and really helps people.